Today I will talk about how to practice in Canada. It will be a video series of Road to Medical Doctors MD in Canada. So basically, why you want to practice in Canada? Why practicing in Canada? So these are the reasons, in my opinion, why someone want to practice in Canada. So equality in care for patients. As the name entitles that every patient that you treat in Canada, you will be doing that equally, and they will have equal opportunity and equal right and access for your health or for your health care. So that's a very big part of healthcare in Canada, and the system is designed in a way that it provides almost everywhere equal access to the healthcare, and it's usually funded by the provinces, which means that the patients usually do not, and I mean always, they do not pay for the consultations. Also, admissions and all the services provided in the hospitals. So that's a very big advantage for the patients, and it's also relieve the physician from the stress around finding best options for their patients and affordable options. I mean, the second part, it's a very rewarding profession financially, meaning that a physician that practicing in Canada will not have any problem in financial means in progressing on that side, and there will be plenty of time, which will get us to the third point, plenty of time for a flexible lifestyle, meaning that they don't have to be at work for long hours and to spend a lot of their family time in working, because the main purpose for their practice will be to serve a patient, and they will be able to secure a good amount or good financial gain in addition to their rewards or their personal satisfaction. So they will have a flexible lifestyle. As we will see how the physicians get paid in Canada, it's very interesting, and it's very important to know for anyone who want to do practice in Canada. The fourth point is, it has Canada in general, the population and the medicine profession, it has a very supportive framework, and the environment is very supportive from the colleagues, from the allied healthcare. So it will create a nice atmosphere and ambient for you to practice. In general, people in Canada is very nice, and the patients is usually understanding your approach and the opportunities in the fifth point for you to grow, meaning that the innovations or the good ideas that you could do to improve on your practice, and if you have any interest in academic settings to pursue any studies, there is a very generous grants and funding for the researchers, and there is a very big need and area there for you to improve. So I guess that will be the main 5 points for someone choosing to come and practicing in Canada. So let's move into the next point. what will you need to have a practice? So now you decided that I need to know what do I need to have a practice in Canada. So general idea there is medicine in Canada is a regulated profession, meaning that it needs a license to start practicing and will require provincial license. The province is the one that license physicians. So after the license, you will need to get privilege in practice site, whether hospitals or clinics. So that means a place for you to allow you to see patients. So there is no salary usually from these practice sites, whether in hospital or clinic. In general, you don't get paid as salaried type, and in general, unless you opted or you agreed with the hospital to have a salary. But in general, physicians usually do not get monthly salaries or yearly salaries from hospitals or clinics in Canada. So that's very interesting, I guess. So how physicians get paid in Canada? Physicians usually get paid by a theme or a way called fee for service. So they are usually considered as a free businessman in terms of payment. That means that if they do provide service, if they do see patients, if they do treat patients, they send their billings to the Ministry of Health in the province, and they will show that they treated this number of patients, and the Ministry of Health will directly bill or pay the physician depending on how many patients or how much service he provided. So the hospital here lies as a practice site, for example, for someone who is going to practice in a hospital, and it has no any relation to the physician's income in general, unless there is some agreement there around the billing part. But usually the physicians they send their receipts or their bills to the Ministry of Health, and they get paid directly to their accounts depending on how much did they see or how many patients did they see. So if you're finding it difficult to understand, you could listen to this presentation again, and I'm hopeful that it will make sense. So let's get to the license part. So how do you go through this process? So this process has mainly 4 pathways for you to get license in Canada. The first pathway is through residency training, and they have 1 intake per year for training in Canada. 1 opening, 1 application, and they usually have 2 seasons or 2 interview seasons, but usually people apply for 1 intake start, and the training starts in July. The second pathway for license is through assessment of equivalent training. So what does the word equivalent training mean? There are certain countries where their training in Canada is considered pretty much equivalent, and you could go through these countries through the province's College of Physicians. But in general, these countries is United States, United Kingdom, Ireland, Republic of Ireland, and Australia, and New Zealand and South Africa. So these countries, the physicians who get trained there, they almost treat it as the same, and they considered having equivalent training. So who do the assessment for these physicians? It's usually done by the College of Physicians of the Federal College of Physicians and Surgeons, which is called the Royal College of Physicians and Surgeons, or the College of Physicians and Surgeons of Family, College of Family Physicians. So this is the federal college, and there is college for each province, meaning that each province has its own College of Physicians and Surgeons, and these provincial colleges are the one who grant the license. They do the assessment and they rely on the federal college assessment in order for them to grant a physician a license to practice. We will talk more about the type of college in this presentation, but this is just a one pathway for someone to have a license in Canada. The third pathway is through assessment of other countries' residency training. So any country out of the equivalent, I would say what I named it, the equivalent training countries, they need to go through practice readiness assessment pathways by provinces. So these are a new pathway, relatively new. It's almost 7 years since it was invented, and it's a pathway where the province take the trained physicians and under certain sets of criteria published at each of every province college of physician. There are criteria in their websites. If you're interested, you could go to the College of Physicians of the interested or the one that you interest you, the province that interests you. You just Google the College of Physicians, for example, of Alberta, College of Physicians and Surgeons of Ontario, and then there is a set of criteria that they and policies that govern their assessment. So practice readiness assessment pathway is well formed in some of the provinces. Other provinces have their internal assessment process or review, and it's all published in the website and it's on their policies. The last pathway is the academic positions, and this pathway is when the universities recruit professors or academic teachers to their universities for academical positions, which means that if the physician is affiliated, or if he is practicing as assistant or associate professor in his home country, and the university in Canada is interested to recruit this physician, they can sponsor him for license to practice medicine in the hospital, the university hospitals, and usually they will have another academical duties. It's also one of the positions, one of the options, and the licensing again is through the Provincial College of Physicians and Surgeons. So now this is in general. Now let's talk about what about the fresh graduates. If you graduated just in this year or last year, how would you be able to get license and practice? So the short answer for that is to try to apply for residency training, because if you apply within 5 years of your graduation with good letters of recommendations from Canadian physicians, your chances are very good or excellent to compete on the residency positions in Canada. So this is the most reasonable pathway for fresh graduate, and it needs from you to go through 3 sets of exams. 2 of them is medicine and 1 of them is language exam. The first exam is a computer-based MCCQ E1 exam. It's a computer-based. You could take in any center around the world. You can take it even nowadays at your home through the proctoring. And this exam is a total of 6 hours and 2 parts, 3 hours each. MCQs, the first part, and the second part is short answers part. The second exam is the NAC-OSCE, which is a clinical exam, and it runs virtually during COVID time. Meaning that you can take it at any place around the world, even at your home. You can take it through the proctoring part virtually. So that's the second clinical exam. The third exam is the IELTS, and that needs an academical version of the test, and it needs a 7 in each of the components of the exam: reading, listening, writing, and speaking. And OET, or Occupational English Test, is an Australian-based English test for medical professions, also for nurses, but the medicine part of, or the medicine OET is under process for acceptance. So this what you can do, like during the last year or so after the graduation. Side by side, you need to work on the other component of the application. You need to start working on the permanent residency status application, and this process can be started while you are in your home country. And there are 2 types of main 2 programs: the federal programs or the provincial programs for immigration. And I could talk more about this in the following videos if you guys are interested in that, but this is a part that is needed for the application. So you cannot apply for residency training without a permanent residency or citizenship status in Canada. So this is really important, and as I said, you need to apply within 5 years of graduation and apply with letters of recommendation in order to be competitive in your application and you get selected. So let's move on. So what about the specialists or general practitioners, GPs? So they can apply for residency again and redo it inside Canada. That's one option. The other option depends on the country of training, as we discussed earlier in this presentation, and how many types of colleges here in Canada. There are 2 main colleges: the Federal Royal College, or the Royal College of Physicians of Family Medicine, and the Specialties College. So 2 types of college. One is regulating the family physicians, and the other one regulating all the other specialties, including medicine, surgery, anesthesia, pathology, all the other specialties. And the second main colleges is the provincial colleges, and these are based on each province. And as we said, the assessment can be done by either the federal or the provincial college, and the provincial college has the last word on saying on the licensing. They rely on the Federal Royal College to provide assessment in some of their pathways. It depends on the province pathways, but the license is granted by the Provincial College of Physicians ultimately. So the final decision to practice in Canada in the province is by Provincial College of Physicians and Surgeons. Therefore, I advise anyone interested into practicing to go to the province of choice and to see what's the criteria there for the specialist or the general practitioner to practice. If you have any questions, that's all what I wanted to say in this presentation. I hope it was helpful for you guys. So if you have any question, just write it in the comments below, and if you would like to have more videos talking about the details around this presentation, please write it in the comment, and please don't forget to subscribe and like the channel. Thank you so much for your time.